to those of you who want to live healthier lifestyles. Or if, like me, you've kind of lived a life of self-neglect and you're being forced to live a healthier lifestyle and you're doing it kicking and screaming. But the help will be very much welcome. Of course, the audience is always the most important part of any show, so we'll also want to hear from you. You can send comments and questions via social media and in the chat if you're viewing online. And you can also send messages to the studio on 0774 8855 That's 0774 8855 So let's get started by welcoming Dr. Laura French. Welcome.
Thank you, Nazira. Pleasure to be here.
Thank you. So you're a consultant in public health, and I'll ask you to tell me a bit about that in just a little bit in a minute. But my first question for you is, what exactly is public health? I've been there 18 months and I'm still figuring it out.
Yeah, it's a very good question and one that lots of people ask. I think partly because it involves so many different things that no one has a real idea of what exactly it is. I think a lot of people, particularly since the COVID pandemic, tend to think of public health as being what we do in terms of controlling infectious diseases, so all of the advice that came out and guidance around COVID. I think historically people think of things like, Florence Nightingale and her work in the hospitals, or Dr. John Snow and his work on cholera in the East End of London. But actually there's quite a lot more to it than just the stuff we do with infectious diseases. Traditionally, we tend to split public health up into three broad bits. So that bit where we're protecting the public from infectious hazards and non-infectious hazards, we call that the health protection element. But aside from that, there's lots of other bits we do. So the bit you're going to be talking to Darshna about later, the kind of lifestyle interventions. We help people to try and live healthy lives. We look at things like smoking rules and regulations, helping people to increase their exercise. And we call that health improvement measures or health promotion, and that's all the stuff you see from formerly Public Health England, now UKHSA, in terms of posters about how to eat well, how to exercise, etc. And then the final kind of bit of what we do is called healthcare public health, and actually that's looking at what healthcare interventions we recommend, what we do healthcare spending on, why, what the evidence is. And then all of those things kind of feed in together. And that's what we do, but kind of fundamentally in public health, what we're about is being advocates for the health and well-being of our population. So in our case, that's the people of Leicester. And we're always working to tackle what we call health inequalities, those differences in health that result from things like where you're born, which communities you're from. And those aren't unavoidable, and we should always be working to tackle those. So that's what we do, really.
Thank you, Laura. I can now sound like I know what I'm talking about when I'm explaining it to other people. So tell us a bit about yourself, Laura, and the role you play in public health as a consultant.
Yeah, so it's a really interesting role. I am a medical doctor by background. I qualified in 2009, and I'd always loved public health as a topic and as a subject in medical school. But when I first came out of medical school, I was keen to be a clinician, and what I loved was obstetrics and gynecology. So after a few sort of general jobs that you always do when you first qualify, I trained in that for 3 years. But I was finding myself getting sort of increasingly frustrated by the things that you see in a hospital that are more to do with, the environment that a patient is living in, their work, that kind of stuff. And you're not really in a position to do anything about it. You're much more downstream picking up the pieces, whereas really what I wanted to be doing was prevention work and working on those things at a population level. So I applied for public health specialty training and was lucky enough to get a training post in the East Midlands. The training's 5 years, so that was 2016 now, and it's brought me down the road, and here I am. Yeah.
Oh, lucky for us too that you ended up in the East Midlands. Actually, so you're not from Leicester. So what brought you here? Of the training, I guess. But what does it mean to be practicing public health in a city like Leicester?
Yeah, you're right. I'm not from Leicester. Originally, I'm from Hull in East Yorkshire, and that's where I grew up. That's where I trained as a doctor, and that's where I did a lot of my early medical jobs. And I did love working there because it's a city and has some similarities with Leicester, but also a lot of differences. So I always enjoyed working in a city rather than working in a rural area. And then obviously I came to train in public health, and that you're based in a region, you don't necessarily get choices over where you go.
Mm.
You have to move around. So I got sent to Leicester in my final year of training, which coincided with a COVID pandemic, which was a very interesting time, let's
nice,
say.
Gentle
a nice
introduction.
gentle introduction to consultanthood, exactly. And basically, like everybody working in public health, you know, we were all going at 100 miles an hour. I just sort of got thrown in at the deep end. I ended up leading on a COVID testing program for the city and then COVID vaccination. And during that time, I really bonded with the team in Leicester, you know, the public health team, but also I felt like I really felt like I had a place here in the city, and that, you know, I felt very fond of it and really felt that sense of place, which is really important when you're doing a public health job. And so when the time came for me to finish training and look for a consultant job, and the director of public health spoke to me about whether or not I'd be thinking about staying, to my surprise, given that I don't live here, I live quite a long way away, I found that I wasn't ready to leave, and I was really keen to stay. It's really a fascinating place to practice public health. You know, there's loads of challenges in terms of lots of people in Leicester are living in areas of deprivation, which means that they suffer, you know, worse health outcomes than they should be doing. We've got a really interesting population in terms of different communities, different ethnicities, and all of that just makes it a fascinating place to work in public health. And really, I wouldn't work anywhere else.
That's good to hear. I'm sure Ivan will be happy to hear that as well. So moving on to sort of what's important in public health right now. And I guess we'll start with looking back, because we've just passed the 3-year anniversary of the first COVID-19 pandemic lockdown. How was that time for you? I mean, we've just heard a little bit about that trial by fire. But how was that time for you? And where are we now as a city when it comes to COVID-19?
Yeah, I can't believe that it's 3 years, really. It feels both a very long time and a very short time. And yeah, I mean, everyone will attest to the fact that those years were not like anything any of us have experienced before. Yeah. They were very difficult times, they were very challenging times, but they were also, for us working in public health, times where we had to do things differently to the ways that we've ever done them before, purely because we were facing situations that we'd never faced before. And obviously in Leicester, we had a particularly kind of unique experience in that we were the first area to go into a local lockdown, which meant that we had longer lockdowns than everybody else. And we were initially the focus of all of that, you know, really intense national attention on what we were doing. But actually, you know, really what we learned during that time was that those kind of national one-size-fits-all interventions don't really work as well. And what we really needed was a much more local approach. So that really shaped then the way that we moved forward in terms of managing the pandemic. But yeah, it's been hard. It's been really hard for the people of Leicester. It's been difficult for everyone working in, you know, health or any frontline services, social care, and really there's not been a great deal of let up, because although the, you know, COVID rates have become much lower, although there is certainly some COVID circulating at the moment. The pressures on the NHS didn't really decrease by virtue of the fact that, you know, we kind of crashed into a winter, and then you've got all of the winter pressures, etc. Yeah. Everyone's still been working at 100 miles an hour, and it's been really tough. COVID-wise, it's a funny one. So you don't obviously hear as much about it in the news, but I would hazard a guess that most people listening probably know somebody at the moment that's got COVID.
Yes,
because there's a fair bit of it about, and although the vaccinations have done a really good job in protecting people from severe COVID, we're not seeing lots and lots of people filling up hospital beds. It's still the case that people who have, you know, underlying health conditions or who are otherwise vulnerable, you know, that's still a worry for them, and for a lot of people that will be stopping them coming out and moving around perhaps in the way they would have done pre-pandemic. And we're obviously moving out of winter, which means that, you know, there are fewer other kind of respiratory viruses circulating, but it's still, you know, really important to stick to all the things that we have been doing over the last 3 years. So making sure you wash your hands and don't touch your face too much if you have a cold or, you know, a cough, or get a COVID test, or try and stay at home if you can. It's difficult when, you know, it's not necessarily at the front of everyone's mind anymore, but it certainly hasn't gone away.
Yeah, we know. We know from various sort of projects and things we're working on. So the key message is COVID is still important, although we are sort of living with it now. It's still around, and it's still important to be careful. So COVID remains important, but many other issues are also really important for the people of Leicester. So And some of those are because they were, in effect, sidelined during the pandemic. We had this crisis to deal with, and, things had to be put on the back burner. And some are things that were made worse by it. So what are the sort of other big public health priorities for the people of Leicester right now?
Yeah, so obviously, as you've identified, what we know about the pandemic is that it really exacerbated all of those pre-existing inequalities in health that we were seeing before that. So, the people who were having difficulties with health problems before, those things got worse over the pandemic for various reasons. For the population, at large, the real difficulty is that we've kind of come out of that COVID pandemic and crashed straight into a cost of living crisis, which, although isn't health in the truest sense, of course, it affects your health and well-being because
massively
you're worried about being able to pay the bills. You perhaps can't heat your home as much as you'd like to. You can't afford to buy healthy food. You can't perhaps afford the free time to go out and exercise. And that's going to be a huge problem, I think, ongoing.
Yeah.
And certainly that's one of the priorities that, we as a public health team are always keeping in mind, that this is a real thing that's important to people of Leicester. And it's not easy for you to focus on, I don't know, how well you're eating or getting to the gym if, you're just worried about being able to afford your rent at the end of the month. So
well, we're hearing of people choosing between eating and health, or mental health and things like that. So, absolutely, it's having that impact.
Yeah, and aside from that, I think there's some other things. So you alluded to, things perhaps being put on the back burner during COVID, and certainly there will be people who's, have chronic illnesses who are waiting for treatment, whose waiting time has been longer than it should be. There's also a few other things that we will probably cover in more detail in these programmes as we go along. But things that we think about in public health are the uptake of things like screening measures.
Yes.
So most of the screening programs were kind of paused or, didn't kind of happen quite as much, or people thought they weren't happening. So things like cervical screening or bowel cancer screening, uptakes of all of those screening programs in the city have fallen. And that's something that does concern us because they are important in terms of identifying people at risk. Vaccinations. So obviously there's been a lot of talk about COVID vaccination over the past 3 years or so. There's actually going to be a spring booster campaign starting next month. So if you are over 75 or you have a background health problem, you're immunocompromised, then please do talk to your GP about getting your COVID booster in the spring. But in terms of other vaccination programs, we've also seen a fall in uptake of those. So that's everything from flu vaccinations through to school vaccinations, things like MMR, childhood vaccinations. And it's kind of, I think it's multifactorial and complicated why that's happened, but it's definitely a concern for us in public health and something that we're going to be looking at tackling because it stores up problems for down the line. What we don't want to be seeing is outbreaks of vaccine preventable disease like measles in kids and other things. So
and some of these because there is variation in how different things affect different communities, isn't it? So Leicester health inequalities wise kind of fares worse in a lot of fronts compared to the rest of the country, and then within Leicester we have a lot of variation. So some of these things that you mentioned, like screening, are particularly important for some communities. So could you just sort of touch on that a little bit for us?
Yeah, absolutely. So we think about health inequalities classically in terms of deprivation, so what postcode you live in, how much money you have in your household, but actually it's not just that at all. As you point out, it's different health affects different communities differently. So it might be, if you are older or if you're from a Black Caribbean or African community, you might be more at risk of specific things. Sometimes women more than men. So all of those things can kind of work together to make people be much more at risk of certain health conditions. And I think one of the things I could start going into some specifics, but actually there's so many and they're so, subtle that it's probably not worth generalizing. But what I would say is one of the things that we've really learned during COVID is the need to listen to our communities about what worries them, what, for example, if they're not uptaking their bowel cancer screening, why is that? What can we do differently to help that happen? And so we've kind of developed that through our Community Wellbeing Champions Network, which of course you are heading up.
Oh, very cleverly brought in there, Laura.
Which started out really as a kind of COVID vaccination, COVID anti-COVID measure during the pandemic, but really we always knew that we had to have a wider eye on well-being, because the pandemic was always going to exacerbate all those problems. And so that network is growing, and it's got membership of lots of different voluntary and community sector organisations from around the city, who feed into us as a public health team, and vice versa, so they help us get our messages out. But the real asset of that network is that we now have people within communities that can tell us those things, what's important to you, what's worrying you, why isn't this working for you, what can we do differently, because that's what you really need, is that community level intel about these things. It's again coming back to that idea of national programs don't work. Formerly PHE could perhaps put out a campaign saying, it's really important to get your cervical screening, and put it on a poster. But that's not going to work for everyone at all. So what we need to do is work together with communities in partnership to kind of tackle these individual things. And as you rightly point out, it's not going to be the same things that are top of everybody's worry list. Everyone's got different things going on.
And different barriers and to having their health needs met, and that might be different for depending on your background, language, other sort of accessibility reasons, all of that sort of stuff. So I'll do a shout out to our champions, because they've been so brilliant in bringing us lots of amazing valuable insight into the needs of communities and the challenges that they're facing in having those health needs met. So thank you, champions. So looking forward, so we've looked back, we've talked about what's happening now. So now, what is exactly the vision for public health? What are we trying to achieve, and how will we do this? And I know that's a massive question,
Well, it's a massive question, and it's a simple question. So, fundamentally, like I mentioned at the beginning, our vision is for a Leicester where, everybody is living a happy and healthy life, and, maximises their well-being and achieving things to the best of their potential. And that's really, as a public health team, what we're always working towards. We want to make it so that people aren't unfairly disadvantaged by where they're born, or where they're from, or what their gender is, or any of that stuff. So that's kind of what we're working towards, but obviously that's a very broad goal. So how we do that is a little bit different. So what we're doing really in public health is, since the pandemic, we had trying to work more in partnerships. So although we did do that before the pandemic, certainly particularly with health, health colleagues, etc., and other departments in the council, it was really, really important during the pandemic that we did that. We worked much more closely with partners in health. We were able to access data that we hadn't been able to access before. We had a structure within the council for looking at COVID measures that included people from housing, from all sorts of different departments. And also we made all of those community links that we've been talking about. So what we're keen to do is really make sure that continues to happen, that we don't go back to working all in our individual silos where we don't work together. And even within the public health team, we're doing a lot more cross-working. So, for example, you and I work on the Community Wellbeing Champions team, but that doesn't mean that it's just us that work on it. When colleagues in other teams might want to talk to them about something, so perhaps the people who work on our 0 to 19s team are looking at school nursing, and they want to find out what people want from that, they come and talk to our Community Champions Network. So we're trying to keep that kind of spirit of cross-team working and cross-organisational working, carry that forward. And you can see that actually also in the way that we've been looking at cost of living. So one of the things that we've done in terms of trying to limit the effects of the cost of living for Leicester is to approach it like we did the pandemic. So this is an incident that threatens the health of the people of Leicester. What are we going to do about it? And so we've formed our incident management team, which is led by public health, but feeds in from lots of different parts of the council, lots of different, so health and social care colleagues, community organisations, voluntary sector organisations. And we're kind of applying that learning from the pandemic to what we do with that, so that we make sure that we're finding out about things in a timely fashion and in a way that means that there are priorities for our communities, and we've got a forum there of people who can immediately kind of start working on the solutions. So that's it's quite a new way of doing things, but so far I think it's working really well, and hopefully it kind of sets an example for future, in that when we come across these big societal issues that are, health, they're a threat to health.
Yeah.
We don't just say, oh, that's a public health problem, or that's a finance problem, or this, that, and the other. We keep that spirit of working together to try and help things get better, essentially.
Yeah. Brilliant. Thank you, Laura. That's really great. So what we're going to do now is, in terms of the vision and the future and prevention and achieving things, I'm trying to form a nice, smooth link to the next guest, but I'm not sure I'm doing very well. But I will just pause there before I do introduce our next guest to just sort of say, if you are a champion for health and wellbeing in your community and you want to keep up to date with what is happening in public health, you can join the Community Wellbeing Champions Network mailing list, excuse me, by emailing us on wellbeingchampions@leicester.gov.uk. So that's Wellbeing Champions, all as one word, no hyphens or dots or anything in the middle, at leicester.gov.uk. We're also welcoming your suggestions and requests for what you would like covered on the remaining shows. So we've got 3 more shows after today. The programs are not set in stone, and some might call that disorganized, but we're calling it democratic. So because we're ready to respond to what you would like to hear more about. So do get in touch with us again on wellbeingchampions@leicester.gov.uk. And remember, you can still get in touch today with your questions and comments on social media or in the chat if you're listening online, and by messaging the studio on 0774 8855 So our next guest, and Laura is staying with us, thank you, Laura, and we're going to be joined now, I believe, are we ready? By Darshna Ruparelia, Live Well Coordinator. Welcome, Darshna. Thank you for being with us today. Yes, we can hear you perfectly. Thank you. Darshna, thank you for joining us. Please begin by telling us a bit about the Live Well service. Mm-hmm. Thank you, Darshna. We'll go into each of those in a little bit more detail in a bit. But tell us a little bit about yourself as well and the role that you play in Live Well as a coordinator. Mm-hmm. Mm. Yeah. That's That's really good to hear that. You've taken away one of my questions because I was going to ask about cost later. And I'm sure the audience will be really, really pleased to hear, especially in a cost of living crisis, that this isn't going to cost them a single penny. So thank you, Darshna. And this is what I love about working at Public Health. Everyone is just so passionate about the city and about making a difference. And it's a really great team to be in. And I think we might have to touch on recruitment and careers in public health in one of the programs, because we know there are really talented people out there as well, so we'd love to have you on our team. So we might have to bring that back to one of the shows. Anyway, so Darshna, so we'll kind of work through you touched on a lot of the different services that you provide in Live Well. We'll start working through those a bit one by one, if that's okay. Yeah. If we start with kind of healthily eating and losing weight, and audience, I'm just going to say, please don't switch off. We're not taking away your right to samosas. I would never allow that. But if you do want to eat healthier and lose weight, Darshna, what services are available? Mm-hmm. Yep. Mm-hmm. Right. Mm-hmm. And is that sort of tailored to different communities? Because I've always had a weight problem as a young as in school. I was given diet sheets, and they would bear no relevance to what I ate at home. And so, my understanding is things have moved on. So, is the advice tailored to sort of different diets, like Indian diets, and African, and so on and so forth? Right. Mm. Yeah. Yeah. That sounds really positive, really sort of inclusive and supportive, because we do have such diverse language needs, and it's not always possible to provide it information in every sort of language that we have in the city. So yeah, that sounds really brilliant. Okay, so Darshna, we can move on to talking about physical activity now, I guess, which sort of relates also to weight loss, but also physical activity for other reasons, like you mentioned earlier. So if you could tell us more about those programs. Mm. Mm. Okay. Yeah. That's really great. Yeah. Mm. Yeah. It's brilliant. Yeah. 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 And they are a really great bunch, the healthy lifestyle advisors. So if you're worried about going along to a program, don't be worried. They'll take really good care of you. I've met a few of them and they are great. Okay, those all sound really great. Thanks, Darshna. The next thing I'd like to go into is smoking cessation. So every Muslim knows the post-iftar clouds of smoke outside masjids as those who have had to hold off smoking during their fast kind of light up. It can be a familiar sight. So there will be people this month who are cutting back or trying to quit altogether, that might normally smoke. So this might actually be quite relevant to some of our listeners. Please tell us about the smoking cessation service. Mm. Mm-hmm. Yeah. Yeah. Mm-hmm. Mm-hmm. Yeah. Okay. Yeah. Brilliant. Okay. Again, it's that thing of removing every barrier possible to being able to become healthier, isn't it? That sort of that's the public health ethos, if you like.
Absolutely.
That's everything. Yeah.
I wonder if I could just pick up a
Sure.
couple of points. So, when you asked me earlier about challenges that face people in general, people of Leicester, one of the things I didn't mention was smoking, partly because I knew that Darshna was coming along.
Yeah.
But yeah, it's always worth mentioning that if you smoke, then actually giving up or cutting down is probably one of the single biggest things you can do for your own health. And the health of those around you, particularly if you've got young children in the house or if you're a pregnant woman, especially if you're a pregnant woman, you get your partner to quit as well. That's sort of much more successful.
Two for the price of one.
But yeah, it's a huge thing for your health, and also at the moment for your pocket.
Yes.
So it's a kind of wraparound thing to
Yeah.
do in that way. But as Darshna mentioned, we do understand that it's really difficult.
Yeah.
And I think one of the themes that came through from all of the things that Darshna's just spoken about, which we were also talking about before, is this idea that it's not a one-size-fits-all approach, whether that be with communities or with individuals. It's about understanding that different things, work for different people. And it sounds like Live Well have got such a fabulous offer in terms of finding
it sounds
things
really
that can work
tailored.
for you. Absolutely.
Yeah, really brilliant. We are sort of heading towards the end of the show, but we will just touch on a couple more things. I do want to mention alcohol reduction, which might not sound like it's relevant to our listeners here at Ramadan Radio, but we do have listeners from other backgrounds. And we also know from other topics covered in other Ramadan Radio shows, such as the programs covering addiction, that there are people with a need for this kind of support within our community too. So I don't want to sort of slide past that. If you could just briefly mention, Darshna, what support is available for help with alcohol reduction, that would be really wonderful. Mm. Yeah. Okay. Thank you, Darshna. So we cover a lot of services there, and I imagine there's sort of differences in eligibility criteria and things like that. So I won't ask you to explain every single thing, but what's the simplest way for people to go about accessing the Live Well services that they feel might be useful for them? Mhm. Yes, please. Okay. If you could just repeat that number for us, if that's okay. Yeah. Okay. Thank you. Yeah. Okay.